Last week was National Nurse Practitioner Week, and New York honored the 15,000 nurse practitioners currently working in the state. They serve as primary care providers for many people, particularly in rural areas, and the demand is only expected to go up. That is thanks to the Affordable Care Act, also known as Obamacare. With me in studio tonight to explain is the Executive Director of Nurse Practitioner Association of New York State, Dr. Stephen Ferrara. Across the table we have Deanna Brady. She's a nurse practitioner from Oneida County outside Utica. Welcome. Welcome back. Nice to see you. Okay, so Nurse Practitioner Week, I didn't even know we had one of these. What does it mean?
It's a recognition of the work that nurse practitioners do across the state. So it's a week that we recognize the contributions that nurse practitioners make to patient care every day.
Was there something in particular that happened? Did the governor issue a proclamation?
There was a proclamation.
Okay. Did people know that it was Nurse Practitioner Week when they came in to see you?
Some of them that read the Sunday paper knew because there was a little article thanking us for everything that we did in Sunday's paper. Right. For the most part.
Okay, so this is a time when we still have a shortage of nurse practitioners. Just before we came on camera here, you were telling me how many patients do you have?
I have a little over 1,600.
And that's normal?
In primary care.
And they're yours, not
they're
just
my
all
patients.
yours.
Yeah.
And that is the average? What is the average?
Yeah, a panel of patients can average from 1,500 to 2,000 patients for any single provider.
And those people, the assumption is they're not coming in every week, right? I mean, that's what makes it manageable?
Right. It's primary care, so they're coming in for episodic visits, they're coming in for wellness visits, immunizations, those types of things.
So how is that going to change based on the Affordable Care Act or Obamacare, or whatever it is that people are calling it these days?
Well, the Affordable Care Act creates this increased need for primary care. And primary care is very in line with what nurse practitioners do, and it's based on our training. And our training and education approach is patient-centered. And that's what everybody's talking about today, is this patient-centered approach. So it's being able to recognize illness, preventative care, treat episodic conditions, and be able to provide that service to those patients.
Yeah, so this is interesting. So in all of the coverage that we've been giving for the Affordable Care Act, we've talked about the importance of signing more people up who don't have health care insurance now, right? That's what, or you pay a penalty, et cetera. But we haven't really talked about where those people are going to get their health care. So can you fit more people in? You have 1,600 patients already.
I could probably fit in a few more, but I think that the bigger problem is addressing full autonomy for nurse practitioners. We have 16,000 nurse practitioners in New York State, and if we're allowed to practice to our full autonomy, to our full scope of practice that our education allows us to, we'll be able to move out into more rural areas where there's such a need for health care. Okay,
right. So this is what we discussed the last time that you were here. This is the idea that you don't necessarily have to have an agreement, an operating agreement.
A written practice agreement.
Right,
a
with
piece
a
of paper that says that you have to check my charts and that we have to dot your I's and cross your T's.
Okay, this didn't go anywhere in the legislative session, correct?
Correct.
But the doctors dislike it a lot. It seems like to me. We also talked about this a little bit. You're not cutting into their patient numbers?
No, there's enough patients for everybody. And actually the Institute of Medicine, the AARP, and the National Governors Association support full autonomy for nurse practitioners.
And what would it enable a nurse practitioner to do that they're not doing now?
What ends up happening is that the care for the nurse practitioner is tethered to the physician.
Right.
So it's not necessarily that every nurse practitioner in New York State wants to open up their own practice, but that care hinges upon the fact that if something happens to their collaborating physician, essentially on that day they cease to see patients. So in Deanna's case, if her collaborating physician says to her, Deanna, I took another job or I lost my license for some reason, those 1,600 patients that physician has really little to do with directly, Deanna can't provide those.
Would you open your own practice?
I would.
You would?
I would.
And you would be then, you would like work with other nurse practitioners, or you think you
potentially
you would hang out your own shingle? Do you think that there are a lot of people, I mean obviously you're talking to a lot of nurse practitioners who would go that route? I mean, would that fill in the problem that we're probably going to see? Already a shortage of medical care in the rural areas, right, and difficulty. Already people who are stressed because of health insurance requirements on the paper filing and how expensive it is to be insured as a practicing physician, a nurse practitioner. If in fact you untethered these two, more people, this would help the shortage, you think?
I think so. I also teach at the State University of New York in the nurse practitioner program, and a lot of the new graduates are looking for towards the future into opening their own practices and moving out into more rural areas.
And we have data that suggests, so a third of the states across the United States have this full practice authority. So nurse practitioners are not tethered to the physician. And in those states, the nurse practitioners see higher rates of Medicare patients for primary care than elsewhere. So we know, we're starting to see this evidence suggest that nurse practitioners are going to take care of those patients. They're not going to go to the areas where you know it's nice to be. They're going to go in the rural and urban areas, and they're going to provide that service.
Joe, isn't there also a situation now where you have an increasing number of doctors saying we don't want to take Medicaid anymore?
Yes.
You do. So
yes.
We expect that as part of Obamacare, we're going to have an influx of Medicaid patients. In fact, already, well, the last time I looked, I know the numbers are different now, but New York had about 50,000 and change folks who had signed up.
That's right.
And roughly half of those were Medicaid. Well, if people aren't giving any Medicaid services, taking Medicaid patients, what does that mean? Will nurse practitioners be willing to do that?
Yeah, we want to step in and fill the void. We want to be there to support our patients. It's all about the patient care. That's where our training is all about, the whole patient. And if it means Medicaid, Medicare, no insurance, then that's what we do.
What do you think is the outlook, I mean, for this in the 2014 session? I mean, we believe that the governor put this into his original budget proposal last year.
In 2013, yeah.
And it didn't go anywhere. So now we're looking at 2014.
Right.
So what's the outlook there?
We're hopeful that the governor inserts that language in the budget again, and that the Assembly and Senate take it up and seriously say, let's not have what happened in Massachusetts when they passed their mandatory health insurance.
Right.
The average wait for primary care went from 50 days to over 100 days.
For new patients too, or should people who already have insurance be concerned about that? Will your 1,600 folks be waiting because of the Affordable Care Act, the influx of new patients?
Yes.
They potentially will. Okay.
Yeah. So you have this ripe environment that something needs to be done. So the healthcare system has been revamped, but nothing's been done to address the healthcare workforce. And that's where we really need to be on the same page, because if not, you know, this is not a doomsday scenario. We don't want to say that people are not going to be able to get into their provider, but it's going to be difficult.
What about liability? I mean, what is the situation now when you have this written agreement? Who's liable? Both of you?
Yes. And actually, it puts a physician more at risk by doing a chart review, because ultimately I'm responsible for what I do with my patients. But when a physician comes and looks at a chart and makes a recommendation or comments on something, he's now responsible for that patient as well.
The argument, I mean, when this got killed, I mean, did it get killed by a lobbying effort, or it just never moved?
It never moved. It never moved. So 2014, the bills still are there. They'll be reintroduced into the, well, they don't need to be reintroduced, but they're still sitting in committee.
Right.
With the same bill numbers.
Right. So is there an argument being made at all about the level of care? In other words, well, a full-fledged doctor is going to be able to give you more knowledgeable care, more expertise, for example?
That may be what they say, but if you look at the outcome studies, it doesn't show any difference. We give just as good care, if not better care in some instances.
And you also, like a doctor would do, would recommend a person see somebody else if in fact you found something that was beyond the scope of your practice.
Correct. We refer to specialists all the time. I collaborate with all kinds of people. I collaborate with physical therapists, to chiropractors, to ophthalmologists, to gastroenterologists. It doesn't matter. If a patient needs somebody else to look at them, then they're going to get somebody else to look at them.
We've recognized that there's overlapping scope of services with professions today. And it's okay that there's this overlap. And actually, out of the University of Albany, Jean Moore co-authored a study that said that nurse practitioners should be allowed, among other areas, other workforce participants, to practice to that full scope of practice that is not regulated by sort of the legal requirement, but based on the competency of the nurse practitioner education and training.
So, okay, here's another issue that we'll be following into 2014. I thank you both for being here. It's been a pleasure speaking with you.
Thank you very much.
Let us know.
Will do.
Okay.